Hello students, today we will see the anatomy of the tongue. Anatomy. The introduction: tongue is a solid conical muscular organ. It is covered by mucous membrane and lies partly in oral cavity and partly in the pharynx, that is the oropharynx. Coming to nerve supply. Now the nerve supply of tongue is divided into motor, sensory. In sensory, there are general sensations and the taste sensations, and then there is secretomotor along with the sympathetic, that is vasomotor. So first we will see the motor supply. It is also called as somatomotor because there are skeletal muscles in the tongue. All the muscles of tongue are supplied by hypoglossal, which is the 12th cranial nerve, except one muscle, that is palatoglossus, which is supplied. This is coming from palate, so it has the nerve supply of the palate, that is cranial part of accessory nerve. The proprioceptive fibers from the tongue traverse via the lingual nerve. They go through the trigeminal nerve and ultimately into the mesencephalic nucleus. The sensory supply, in that general and gustatory or taste sensations. Now tongue is divided into anterior 2/3, posterior 1/3 and posterior most part. From the anterior 2/3, general senses are carried through the lingual nerve, whereas the special senses carried through the chorda tympani nerve. From posterior 1/3, now this anterior 2/3 is except the valette papillae, and the posterior 1/3 including the circumvallate papillae. The sensations, both general as well as special, are carried via the glossopharyngeal nerve. The posterior most part, both general and special, are carried via the vagus nerve through internal laryngeal branch, which is a branch of superior laryngeal. The secretomotor pathway of the glands of the tongue is same like the submandibular gland. So the preganglionic fibers, they arise, we all know they arise from the superior salivatory nucleus. From there they will go, these fibers will come along the chorda tympani nerve and they will relay into the submandibular ganglion, and via the lingual nerve they will go to the lingual glands. Now the vasomotor fibers are coming from superior cervical ganglion via the plexus around the sympathetic plexus around the lingual artery. Now in the question, if it is asked to correlate the nerve supply of the tongue with its embryology, so this is in short the embryology of the tongue. The tongue arises by two lingual swellings which are present on either side in the floor of the pharynx. These lingual swellings arise in the region of the first pharyngeal arch. Then there is a central swelling, that is the tuberculum impar. Behind there is a hypobranchial eminence which is divided into two halves, cranial and caudal. The caudal part forms the epiglottis, whereas the cranial part forms the posterior 1/3 of the tongue. Now at the junction of this, so the yellow colored part and this pink colored, this is going to form the anterior 2/3 of the tongue, and the blue colored part derived from hypobranchial eminence, this is going to form the posterior 1/3 of the tongue. Now this posterior 1/3 is in the region of the third, fourth pharyngeal arches. So this anterior 2/3 is derived from the first arch, and the pre-traumatic nerve of the first arch is the chorda tympani and the post-traumatic is the lingual nerve. Hence these are supplying the anterior 2/3. Now this second arch gets buried, as you can see in this second diagram. The second arch is buried below, and so the third arch overgrows, and the nerve of third arch is the glossopharyngeal nerve. Hence the circumvallate papillae along with posterior 1/3 is supplied by the glossopharyngeal now. The posterior most part is supplied by the vagus. It is derived from the fourth arch, and vagus is the nerve of the fourth arch. Hence, it is supplied by branches of the vagus nerve. So, this is how we can correlate the embryology with the nerve supply of the tongue. Coming to the blood supply, the arteries are lingual artery, which is the chief artery. It is a tortuous artery which allows the movements of the tongue. It supplies by its main branch, that is called the arteria profunda linguae, which supplies main bulk of the tongue, and there are few dorsal lingual branches. So this is the arteria profunda linguae, and there are few dorsal lingual branches, and there is sublingual artery which supply the remaining part. Also there are branches from the facial artery, that is ascending palatine and tonsillar, and branches from the ascending pharyngeal, which is a branch of external carotid artery. The veins are divided into superficial and deep. The superficial drain from the tip and under surface and accompany the venae comitans of the hypoglossal, ultimately go to the internal jugular vein. The deep veins, they form the main veins and they drain separately or join the venae comitans and drain into internal jugular vein. Coming to the lymphatic drainage, now tongue has a very wide lymphatic drainage and a rich lymphatic supply. So the lymphatics are divided into the lymphatics from the apex, the apical group, then the lymphatics from the sides of the tongue, the lymphatics from the central zone, and the lymphatics from the posterior aspect. So the apical set of the lymphatics, these either go directly or they decussate, they cross and they go to the submental. So first group is the submental group of lymph nodes. Then from the lateral side they go to the submandibular group of lymph nodes from the apex only, and the third group, they from submandibular ultimately they will go to the deep group, that is jugulodigastric or jugulo-omohyoid, and some of the lymphatics directly go to this deep groups, that is jugulodigastric or jugulo-omohyoid. Now from the apical portion of the tongue has got a rich lymphatic drainage. From the margins of the tongue, marginal lymph nodes, they go to the submandibular and jugulodigastric and jugulo-omohyoid. This jugulo-omohyoid, which is a deep group of lymph nodes, deep cervical lymph nodes, is the main lymph node of the tongue. The central lymphatics, with or without decussation, without crossing, they go on either sides to submandibular and jugulodigastric or jugulo-omohyoid. From the posterior one-third, they directly go into the jugulo-omohyoid, or they may cross, or they may go to, first they may go to jugulodigastric followed by jugulo-omohyoid. So overall the tongue has a very rich lymphatic drainage, which is very important in cancers of the tongue. So here you can see how the lymphatic plexuses are formed, and this is the level of the jugulodigastric lymph node, which is higher up near the digastric muscle, and this is the jugulo-omohyoid, which is the main lymph node which is at the level of omohyoid muscle. The peculiarities of these lymphatics of tongue is that they are very important in the spread of cancer. These lymphatics do not accompany the blood vessels. The lymphatics which are in the midline, they freely cross or decussate, The tip of the tongue has richest lymphatics, so cancer from there can spread not just to submental lymph nodes but to the lymph nodes, deep group of lymph nodes on both the sides of the neck. The node at the bifurcation of the common carotid artery is the principal node of the tongue.